As a resident, you have a specific role in assessing medical learners. By the time a medical student graduates from medical school, they are supposed to have achieved a list of core competencies. This ensures they are ready to enter internship in their chosen specialty. Please take a moment to review the competencies. You will be teaching learners in your specific discipline. Please click on the link and find the goals and objectives for your discipline. As a resident, you will be responsible for ensuring they cover these goals and objectives on your rotation. All students are required to complete multiple direct observation forms for each clerkship, rotation, or block. To ensure the students get the best possible feedback, it's helpful to, first, ask them what they are most interested in being observed on, and whether there are any issues they are trying to improve. Secondly, observe them perform until you have 3 pieces of feedback, either positive or constructive. Finally, write the feedback on the form, and then sit down with the learner to debrief. Direct observation forms are not used for grading and are only used for the purpose of helping the student improve. If you have a student who is having difficulty, please make sure that someone in authority is made aware. Options include your attending, the course director, the site director, or the clerkship director. Ultimately, our job as teachers is to ensure students are ready to move on. If a learner is not making appropriate progress, you are actually helping them by alerting someone in authority so that the many resources at the school can be engaged and made accessible to the learner and help the learner achieve their goals. As a resident, you may complete an end-of-rotation evaluation form. However, you will not be responsible for determining a student's grade. Let's walk through a scenario. As a grader, you're responsible for documenting what the specific skills of the individual are based on the observed performance. You are not responsible for comparing them to anyone else or determining a grade. You've observed Jessica present about patients for 2 weeks. 2 presentations particularly stand out in your mind as representative examples of her performance. On a patient with chest pain, Jessica was able to give a concise history that included all the pertinent information and develop an effective differential diagnosis. You needed to help her developing the plan. You had to ask several questions. On a patient with acute abnormal pain, Jessica struggled to include the important information. Although her presentation was organized, you had to ask several questions to fully understand what was going on with the patient. Jessica needed help figuring out what was going on. Depending on how frequently you observed each presentation style and how complicated the patients were that you observed her on, you may have selected any of these 3 options to rate her on. Sometimes you will be asked to rate a learner on a skill that you did not observe. In this case, please select the insufficient contact box. This does not harm the learner and provides more accurate information to the clerkship director. Let's transition to giving comments to the learners. When writing comments, remember to describe what the student did in detail. Provide specific examples and avoid cliches. Use the specific assessment framework competencies, EPAs, or the specific goals and objectives of the experience to structure your comments. Describe what the learner can do to move to the next level. The first comment section is for summary comments. These comments go in the Medical Student Performance Evaluation, or the MSPE, which may be used in the Dean's Letter. The second section is for additional feedback that is intended explicitly for students and the clerkship director. These comments are not included in the MSPE. These comments are meant to help the student improve. Specific comments about observed behaviors help to communicate the basis for your rating and provide excellent feedback to the student. The comments in this section can be included in the Dean's Letter or MSPE. These comments need to be carefully worded to communicate to residency directors who will use them to select students. Let's look at a couple examples of what's appropriate to put in the summary comments section. Let's look at another example. Now let's look at a couple examples of additional feedback to students. Let's look at one last example. In summary, as a resident, your responsibilities are to help ensure that students are moving towards achievement of the MD program competencies, teach students based on the goals and objectives of each rotation, observe students and provide them with feedback, identify students who are struggling and need more help, and alerting the course director, complete an end of rotation evaluation form. When providing feedback or completing evaluations, be specific and give examples of what you saw. Remember, your role is not to grade, but observe and record what you see.